Hello everyone, my name is Lemel Gouet. Today I'm going to talk about the case details. The personal data, the age 15 years old, the gender female, chief complaint, the patient consulted at the dentist for the pain in the teeth, the angle of the mandible and the neck. Personal data, age 15 years old, gender female, chief complaint, patient consulted to the dentist for the pain in the teeth, the angle of the mandible and the neck. Medical history: no neurological symptoms were reported to located. No panoramic image showed the overall increase of the bone density of the maxillomandibular region and associated with the bone. Lab evaluation: increase in S-acid phosphate, increase in S-bone-specific alkaline phosphate.
Good morning everyone, I'm Ruba Abulhos. Today I'm gonna talk about the radiographic interpretation. Radiographic interpretation: location, inferior alveolar canal, epicenter of the lesion above, posterior left molars, mandible, angle and both jaw, generalized opacity, size and shape oval to circular, extent, generalized bone, apposition in and the skeleton, vertebrae, jaw, both, especially in the joint. Periphery: well-defined opacity capsulated with well-defined radiolucent margins. Internal structure totally radio-opaque, affected on the surrounding structure, hypercementosis of the left molar, increased intensity of the jaw.
Hi, my name is Rayana Sharifi, and in my part I will talk about the differential diagnosis. The first differential diagnosis is osteoporosis or marble bone disease. The common age group is between 50 to 60 years old. The most clinical feature is characterized by overlay dense bone areas throughout the body, appearing to be brittle, that gives the marble bone appearance. For effect on the jaw, it will increase the bone density with the failure to reveal internal structure. For the effect on the teeth, it can cause delay eruption as well as hypercementosis. For radiographic features, uniformly opaque skull vault with narrow cranial foramina. It's symmetrical and bilateral. For the lab evaluation, increased in a specific alkaline phosphate and specific acid phosphate. The second differential diagnosis is the Paget disease. The common age group is between 50 to 60 years old and some reported in their 20s. Clinical feature: abnormal resorption and apposition in the bone, bowing of legs, curvature of the spine, skull enlargement as well as separation and movement of teeth, neurological pain, and it's the most common feature. For radiographic features, most often in the skull and in the jaw, affect the maxilla more than the mandible, and it's bilateral and can cause hypercementosis. For the lab evaluation, increase in the serum alkaline phosphate. The third differential diagnosis is ichthyropism or familial fibrous dysplasia. The common age group is between 2 to 15 years. Clinical features: firm, painless bilateral enlargement of the lower face, choppy face, pain and fracture, and it's more common in posterior mandible. Radiographic features: it affects posterior mandible, ramus and tuberosity, gives a multilocular pattern, and it causes expansion and cortical boundaries of the maxilla and the mandible, well-defined multilocular, and it affects the bone by expansion. The first differential diagnosis is osteomalacia. The common age group is between 60 to 80. They are more risk to having osteomalacia. Clinical features: the main cause is severe vitamin D deficiency, leading to bone softening, bone pain and tenderness to touch, skeletal deformities such as kyphosis or bowed legs, muscle weakness. For the radiographic features: diffuse demineralization that give the osteopetrotic-like pattern, chorus trabeculae, and for the lab evaluation, increase in the serum alkaline phosphate.
Assalamu alaikum, this is Nur Nasir, and today I will speak about the final diagnosis according to the information given by my colleagues. So, our final diagnosis and the most probable one among our 4DDs is osteopetrosis, which also called marble bone disease or Albus-Schomburg disease, which is an uncommon hereditary disorder that results from defective osteoclasts. Management of osteopetrosis can be by vitamin D, gamma interferon, erythropoietin, and bone marrow transplantation that offer the best chance of longer-term survival of individuals with this type. In pediatric or childhood osteopetrosis, surgery is sometimes needed because of fractures. Adult osteopetrosis typically does not require treatment, but complication of the condition may require intervention. Surgery may be needed for aesthetic or functional reason. Thank you, and these are our references. These are our reference and thank you for listening.